Hi everyone, this is Dushyant from MedSurge India, and today we have with us Dr. Viswanathan Iyer, who is working as a senior consultant neurosurgery department at Zynova Shalby Hospital, Mumbai. And today we are here to ask some of the questions related to neurosurgery. So welcome, Dr. Iyer.
Hello everyone, I am Dr. Viswanathan Iyer, brain and spine surgeon with Zynova Shalby Hospital in India.
So doctor, what inspired you to be in neurosurgery and how do you stay focused and calm during critical procedures?
People keep asking me what inspired me to be a neurosurgeon. As a childhood, I used to read a lot of articles in a magazine called Reader's Digest. And that magazine used to have articles about pediatric brain surgery and a lot of complex brain problems which were sorted by surgery. So probably reading those books in my early grades of school inspired me to be a neurosurgeon. The second question is also about how I keep myself calm and prepared during surgeries. I think with experience and with seniority, automatically you become calm and you become composed. The earliest surgeries were much more, filled with adrenaline and difficulties. As and as the seniority comes, you become more calm. Calmness also comes with thorough preparation and awareness of the subject.
So how do you see the future of neurosurgery? And are there any advancements or breakthrough happening?
I think the brain is the most important organ in the body because the brain is what makes us what we are. In terms of advances in neurosurgery, I think in the last 30 years itself, there have been a lot of significant advances in neurosurgery, both in terms of diagnosis with advanced CT scans, MRIs, advanced digital angiography techniques. In the operation theatre, we have a lot of things like microscope, exoscope, cath lab has been a very, very useful adjunct. Endoscope is definitely much more useful in skull-based tumors and certain diseases. So neurosurgery already is showing a lot of advances, and that has reduced the morbidity and mortality. And the second most important thing is that in today's modern world, it is very difficult for a patient to stay at home for too long. So these advances help the patient to go back to a decent and a fully functional life very soon after surgery.
What are some of the most biggest challenges you have faced during brain or spine surgeries?
The difficulty in brain and spine surgeries is that the brain and spine both are relatively unforgiving organs. There is hardly any scope for error and the implications are very high. And that is why in these surgeries, we do take care that we are extremely well prepared in the OT in terms of our skills and experience, in terms of availability of necessary equipment and well-trained staff. The challenges will remain always, and as we progress in advances, we will probably be able to minimize the risks and complications of brain surgery.
So how do you prepare yourself in managing such complex procedures?
To do advanced brain and spine complex surgeries, preparation is both physical and mental. I think for a surgeon to be able to perform these long duration surgeries with care and with good results, he also has to be very fit physically. So that's why I engage myself in regular activities like cycling. I do cycle quite a lot, and that helps me to remain physically fit. Mentally is always a challenge. We keep discussing good cases amongst our colleagues. We attend neuro conferences, and we also have these regular continuing medical education programs, which keeps us very well aware of modern advances in neurosurgery.
So which neurosurgical procedure is most often performed by you, and what are the challenges associated with them?
Common neurosurgeries include, unfortunately in a country like India, surgeries for head injuries and road accidents. Even though it's a very disheartening thing to operate a young patient with a head injury, we do have to often do that. Very commonly, we operate on head injuries. The second most common is brain tumors, commonly tumors like gliomas and meningiomas. The complications and preparedness involves very good study of the MRI before surgery, assessment of the patient's condition, assessment of the patient and family's expectation after surgery, and also a very well-rounded judgment of what is the life expectancy of the patient and what is the quality of life he expects after such a surgery. After all these points are discussed and analyzed with the operating team and the patient's family, we go ahead with the surgery.
So which is the most complex procedure you have handled up till now, and how do you see the results as per your expectations?
Uh, in the last so many years of practicing neurosurgery, there have been a lot of complex cases. But one case which I remember very clearly and also very happily is of a young girl who had a very severe brain accident, road traffic accident, and she had very severe brain injury. I have to operate her something like 10 to 14 times in the last 7-8 years. But despite all these challenges, she has come out very well. She's back to full functional life. So that's one of my very, very happy and tough both together kind of cases.
So can you explain us some of the common misconceptions related to neurosurgery, and how do you address them with your patients?
The commonest misconception about neurosurgery is that the patient generally tend to assume that brain surgery is with bad results and with a lot of complications. So that is the most important thing we try to guide the patient's family, is that today with all the advances in diagnosis, anesthesia, surgical options, the results are extremely good. And even if there are a few post-operative issues, most of them do get settled with time, physiotherapy, patience, and family care and love.
Thank you everyone for watching this video, and don't forget to like and subscribe this channel for future updates.